Hey guys, so we are going to talk briefly about the movements of the hip. I'm going to do a real quick video on each of the 6 movements. So first, I want you to think about the anterior portion of the thigh, okay, and hip flexion. So if I'm going to shorten this distance, I'm going to have to be on the front, on the anterior surface of my thigh, a muscle on the front, okay? We've got 11 muscles in this region. Some of them are going to run medial, some of them are going to run a little bit lateral, but if they cross over the front, they're going to be pulling the femur into flexion, okay? So let's look at our model here. Okay, so this would be sitting just like this on my leg, okay? So this is the anterior view of the thigh. Lateral here, medial here. Now, you can see very clearly all of these muscles have an anterior leaning, okay? Now, this right here is my psoas major, and he is actually part of the functional group called the hip flexors. The hip flexors are the psoas major and the iliacus together. Sometimes you hear them with their name actually joined together like Brangelina, but it's iliopsoas. So psoas major, iliacus is deep up into here on the iliac fossa. So if you think about your pelvis, both halves being put together, that pubic symphysis coming together right at the pubic bone, and then the inside of the bowl, those are the iliac fossa surfaces, okay? And that's where the iliacus attaches. So the psoas major and the iliacus. Then you see we have our beautiful feather rectus femoris. He comes right up there, and we have our sartorius. Okay, now on yourself, when you bring your hip into flexion, and you can palpate right there, you can feel sartorius at the ASIS. You feel your rectus femoris, and you feel your psoas. Then you should feel mush as you come in medially. So now I want you to take your toe into the ground and drag, give yourself a little bit of resistance, and just medial to the mush, you'll start to feel your adductors come in. Okay, so what we just felt was sartorius, rectus femoris, and psoas major there. Then we felt our mush, and we're going to come in now to the medial aspect, still anterior but medial. Okay, that's your adductor group right there. So we have our pectineus or adductor longus, not gracilis though. Gracilis runs straight down the very center of your thigh, parallel fibers. There's no angled orientation. It does not come anterior at all. It doesn't come anterior. It doesn't come posterior. It's dead center, the middle of your thigh, the medial surface. So he's going to adduct and internally rotate the hip. He doesn't do anything with extension. He doesn't do anything with flexion. He's not anterior. He's not posterior. Okay? The other 4 adductors, though, they do flex the hip. So we have our adductor magnus, longus, and brevis, and then our pectineus. Now, the adductor magnus, if you look right here, you can see his cross section. And right off the bat, you should see how big he is. He wraps all the way to the front and all the way to the back. So there he is to the front and then there to the back. Again, if he's anterior, he's going to flex the hip. If it's on the front of the thigh, it's going to flex the hip. So the anterior fibers of adductor magnus flexes the hip. The posterior fibers extend the hip. So think, if it's on the front and it flexes, if it's on the back, it's going to extend. Okay? Now, brevis you can't see on here, but he is also going to flex the hip. The only adductor who doesn't is gracilis. All right, so that's the next little chunk. So we talked about sartorius, psoas major, iliacus, rectus femoris. Sartorius is kind of a weirdo who flexes the hip. So that was 4. Then we have over here our adductor group. That's another 4. So we have 2 left. Okay? Or really, 3 left, sorry, because there's 11. 3 left. Here, this guy here, he also crosses over the front. Anterior, he goes lateral, okay, but he crosses over the front. That's your TFL, your tensor fascia lata muscle. So he's right there. And tensor fascia lata, this is on the lateral surface. You see that white band? That's your iliotibial tract. Ilio from the ilium down to the tibia, iliotibial tract. You hear a lot of people talk about how their IT band is tight. Okay, it has to do with tightness here in those hips. The glute max also attaches there. So that influences your hip mobility and it can cause a lot of pain. Now, if we peeled off your TFL, this is actually your side butts. If we peeled him off, right under him would be the anterior surface of glute medius. And if we pulled that off, then you would see glute minimus. They are layered on there. And then you would see them fan this way. Glute medius would fan this way. But if we just took off the front part, underneath the TFL, you would see the anterior part of glute med, and then underneath that, you would see glute minimus. So those are the last three: TFL, anterior glute med, and glute min. All right? So those are the muscles that flex the hip. Now, I want you to think real quick about how those glutes flex the hip. So if I'm coming down here to my greater trochanter and I'm making a little heart shape over my hip, I want you to think of this windshield wiper action. Okay, this is glute min on the front, coming from my greater trochanter all the way up here to my ASIS, that whole part of the gluteal surface. That's glute min. So you can also do the pinch method, okay? If I'm coming from my ASIS down to my greater trochanter, and then I'm pulling, I'm going to pull that thigh into internal rotation. I can also pull that thigh into flexion. Now, if I did the opposite over here, so from my greater trochanter to my PSIS, I would pull that femur into external rotation and extension. So the front's going to flex and internally rotate. The back's going to extend and externally rotate. Altogether, glute medius is going to abduct, pulling that leg straight out to the side, okay? So glute min and my TFL, my glute medius is on top of that, but it fans all the way to the back as well. So you've got that layering of three. So glute min, anterior glute med, and then on top of that, TFL. Those are your hip flexors. Sagittal plane movement, medial lateral axis, right? Also, I want you to think about our movement. So if we're in extension and we're returning to anatomical position, that's still flexion, okay? So this is flexion, returning is extension, and then from extension, returning is flexion, okay? So a movement and a position are not necessarily the same thing. You also have to think, just because I'm coming into flexion, that doesn't mean necessarily my flexors are producing that movement. If I'm in a very extended position and gravity is taking my leg back down to anatomical position, my hip flexors didn't have to do any of that, right? Gravity did that. Now, if I do it very slowly and controlled, it's not my hip flexors that are doing it, it's actually my extensors that are slowly controlling my descent back down to a neutral position, okay? So that's still flexion happening, but not because my flexors are doing it. It's actually my extensors that are lengthening. They're generating force, but lengthening while they're doing that. It's called an eccentric contraction, okay? That's the start of understanding the different types of muscular contractions we have. Some of them shorten, some of them lengthen, and then some of them stay the same. So if I'm holding a box and I'm being still, my bicep's still burning, right? He's not getting longer or shorter, but he's still working. He's still exerting force to counteract the weight of the box. That's an isometric contraction, okay? So there's different types of contractions. Hope that helps. We're about to cover extension next.